Hello, everybody on Facebook Live right now. I'm Dr. Shannon Tapia with Medicine on Tap. Today, I wanted to talk a little bit about something I know quite a bit about because a huge proportion of my patients struggle with this, but also so do families and loved ones and people trying to understand. And that is the topic of dementia. And what is dementia? And what do we do when we're saying somebody has dementia? A common misconception I hear from families and loved ones of patients with, quote, dementia is that they were told they had Alzheimer's, but that it's not dementia, or that they were told they have dementia, but that was all they were told. And in fact, dementia is a very broad term. It's essentially like saying you have cancer. I don't mean to say that the significance is the same, but cancer is a very broad term because there are multiple different types of cancers, and each one has a different prognosis, meaning a different course of what that will do, a different time frame, a different chance of getting treated. And so it's important when someone says, I have cancer, to know what type of cancer. So for dementia is essentially a disease of the brain. It's now being called a neurodegenerative disorder or a neurocognitive disorder. Dementia is actually kind of more the layperson's terms. They're not using it as much in medicine, but I don't think the term is going to go away for a long time. So that's what we're talking about. And it's a disorder where you start to lose aspects of your cognition. Memory is frequently involved, but it doesn't always have to be. Things like social recognition, ability to make good judgments, ability to handle complex tasks. I'm trying to think of what else. Language, your behavior can change. So these are changes that happen due to a degeneration of the neurons in your brain. And we call it dementia when enough things have happened that it has an impact in your independence and daily functioning. So there are a number of different people who have mild memory loss, or they notice they have some word finding difficulty, or they do some of our fancy cognitive tests and they're a little abnormal relative to how educated they are in their age cohort, but it really doesn't have any impact on their day-to-day. They're still managing their finances, they're still able to get help where they need it and coordinate it themselves, whatever it may be. Those people we say have mild cognitive impairment. But if you are worried about a loved one who has, either you've noticed something in their memory or they've started acting differently due to whatever their personality used to be, they're no longer as sensitive or able to understand social cues the way they used to, or they're getting lost and they never used to, or they're not able to manage things with their hands and coordination like they used to, that is reasonable to be concerned that they have a dementia. Now, there are a number of types of dementia. When we call it dementia, we mean it is a disease that is not going to go away, meaning it's not reversible and it's not due to another underlying either medical condition or drug side effect or toxicity or whatever there may be. There's a lot of things that can cause your brain to act funny that are medical conditions that are reversible if they're diagnosed and treated. When we say dementia, we're referring to the conditions that are progressive and what we call neurodegenerative, and they do not get better. They progress over time. So the main one is Alzheimer's disease. And a lot of people have heard that. So if someone tells you you have Alzheimer's disease, then you do have a type of dementia. So Alzheimer's disease is the most common because it is the most affiliated with aging. There is a small there's a small cohort of the population that has a genetic, an inherited trait that can put you at risk for developing Alzheimer's much younger than the rest of the population. If anybody saw the movie Still Alice, it is about that type of Alzheimer's. It's a very wonderful movie, and I highly recommend it if you know anyone with dementia and are struggling it. Even if it's not the same type your loved ones have, it still is very, very powerful. Anyway, it's actually a great book too, but who reads anymore? I'm kidding. I read the book, but it's a good movie if you don't have time to read. Anyway, so Alzheimer's is the most common because it's the most affiliated with aging. So the majority of people who get diagnosed with dementia, particularly in their 70s, 80s, 90s, have Alzheimer's disease. And that has been shown to be a particular type where these proteins affect your neurons. They kind of tangle up, they start degrading the brain tissue. However, there's also a lot of overlap with another type of dementia, which people call vascular or multi-infarct dementia. And that type of dementia happens, it can occur with Alzheimer's. I think they're still studying this. Not everybody's sure, because the bottom line is no one really knows until we can autopsy your brain what type you actually had. And obviously, when you're living, we are not going to autopsy your brain. So a lot of it's just based on history and other medical conditions and what limited imaging we have available of the brain at this time. There's lots of research being done. Anyway, vascular dementia or multi-infarct is when, if you know someone who's ever had a stroke or a period of lack of blood flow to a portion of their brain, those neurons frequently, some of them regenerate, but some of them die permanently, and they have long-standing deficits, whether it's in movement or speech or whatever. There is a recognition that sometimes people don't have this huge stroke, but over time, due to either high blood pressure or diabetes, or even sometimes prolonged low blood pressure, the tiny, tiny little arteries that go to your brain and your neurons, they don't get the blood there as much as they should, and over time it creates tiny, minuscule spots where the neurons essentially go away and die due to lack of blood flow. And that's what we call vascular or multi-infarct dementia. Now, if you get old enough, you probably have a mix of both Alzheimer's and vascular dementia. Okay, so those are two of the major ones. And then there are three more that are less common. And one of those, you might have heard the term Lewy body dementia. That is related to Parkinson's disease, but it's not the same. In Lewy body dementia, there are very characteristic findings in usually their history and clinical exam. People tend to have more visual hallucinations. They develop cognitive issues before they develop movement problems. In contrast to Parkinson's disease, where people develop movement issues far before their cognition becomes an issue. Like they can have it for like 20 years before the dementia sets in. Not to say everybody's that way, but so there's Lewy body dementia and Parkinson's dementia, and those are fairly closely related but different. And it matters to know about these because when we're telling families or caregivers what to expect, they have Alzheimer's versus vascular versus Lewy body versus Parkinson's, they have a different time course and different needs throughout. And also sometimes certain things work for some of them that don't work for the others. And that's why it's important that people understand that dementia is not all the same thing. While it's true the majority of it is Alzheimer's disease, it's not all the same. The last one I was going to touch on is something called frontotemporal dementia, and that is based on the name, where both your frontal and temporal lobes of your brain, so this region on each side, is most highly affected. And because of the regions of the brain affected in that type of dementia, there are certain signs and symptoms that, end up changing a person's personality. So people who get frontotemporal dementia, frequently they get it much younger. So in 60s or 70s, we don't necessarily know why yet. There's usually a huge, sometimes their memory is fine, but their personalities change and they end up losing their inhibitions and acting out in ways. A classic example is, somebody who was always on the straight and narrow all of a sudden starts gambling a ton and, saying things that are totally inappropriate. And that type of dementia is much more rare, but also much harder to treat and much harder to deal with due to the significant personality changes. So in learning about dementia, it is not one thing. Dementia is like an umbrella term similar to cancer. The most common type of dementia is Alzheimer's disease, and then followed by multi-infarct, also known as vascular dementia. There is a lot of overlap, and frequently people have a mixed, meaning they have a little bit of both. And then it goes to Lewy body dementia, Parkinson's disease dementia, and frontotemporal. There are other kinds, but those are the 5 most common that we focus on. And they're important because they're significant. It's significant in how we help families and caregivers understand what what their loved ones are going through. I'm trying very hard to keep all of these medicine on tap short enough that they're manageable. So I am not going to get too far into today dealing with, I'm actually looking at the timer right now. I'm almost done. So I'm not going to get too far into dealing with the specific types, but I will do series on that to try to help caregivers and know what to look out for. If you do have questions about the dementias, go to the Alzheimer's Association. They are not specific to Alzheimer's. That's just the majority. There's a ton of resources there. That's my timer. So that was just a basics of the dementias. I don't know how to work my own phone. There, done. And I hope everybody has a wonderful day. And if anybody tuned in, thank you so much. Bye.